So now there are these protective coverings that are basically covering the brain, as well as they're also covering, or they're also extending towards the spinal cord. So the three major protective coverings are the dura mater, we have the pia mater, and the arachnoid mater. They were also present in the brain, and they're also being extended towards the spinal cord as well. The function remains the same, of course. They are providing the protection to the spinal cord. And as you can even evaluate from here, we have the dura mater. Moving on, we have the arachnoid mater. Then we have the pia mater. Now, the pia mater is more vascular in its nature. And again, we can just even, by even remembering or recalling the anatomy over there in the brain, we must know that the main difference between the pia and the arachnoid was that it was also basically being extending into the fissures, the sulci as well. So even over here, it is going to be more extensive in its nature. And obviously, there are these, the function to all of these meningeal structures are basically to provide protection. The CSF is also flowing between the arachnoid mater and the pia mater, and it is basically bathing the spinal cord. And again, it has its own specific properties, starting from the nutritional properties that it has, and then the protective properties, and even it can be taken out for samples and sent to the histopathologist for further reviews. So over here, when we just go through the details of a general architecture of the spinal cord, we know that this is mainly the anterior median fissure. And then we have a central canal where the spinal cord, the CSF is basically bathing along. And these are the dorsal root ganglion that are basically coming out of the spinal cord. Now we have an anterior root, and then we have a posterior root, which is also known as a dorsal root, and then they join together and they form a spinal nerve. So the spinal nerve is having the motor as well as the sensory component along with it, and then it is coming out of the particular corresponding spinal segment. So this is mainly the generalized architecture that we usually observe on a cut section of the spinal cord. This is the spinal nerve, and this is the dorsal root, and this is the ventral root that we were talking about. The anterior root is mostly sensory in its components, and the dorsal root is mostly motor in its components, but they're going to join together. So a spinal root is going to contain the sensory as well as the motor roots, the mixed root basically.